Hello, this video is for radiologic technology students to learn the radiographic criteria of elbow x-rays. The first x-ray that we're going to look at here is the AP projection, AP elbow. This image is done with the patient's entire arm, the upper and lower arm, parallel with the IR, and the interepicondylar line parallel with the IR. The central ray will be perpendicular to the interepicondylar line. So in this image, what we'll be looking for to make sure that the patient's arm is not rotated is we'll look for the epicondyles to be in profile. So we'll be looking for the lateral epicondyle, which is just above the radius, and the medial epicondyle, which is on the ulnar side of the arm. To be both of those condyles need to be demonstrated in profile. We'll also be looking for the olecranon to be seated in the olecranon fossa, and the joint space between, you can see where the capitulum sits on the radial head, and then you can follow around to where the trochlea is here, right there where the ulna is wrapping around the trochlea. We can see that the joint space is open, and this tells us that the arm was fully extended and that the arm was parallel to the IR. Another thing we can assess for proper position of the patient with the interepicondylar line parallel to the IR without rotation of the arm is by looking at the radial head and the radial neck. There should be a little bit of distance. There can be a little bit of distance here between the radial neck and the ulna. And then also we'll look to see if the radial tuberosity is superimposed with the ulna. So the radial tuberosity should be superimposed with the ulna in our true AP elbow position. Now looking at the next image we have here, this patient is in an externally rotated arm, which is our external or lateral oblique position. So the arm was rotated, the patient's thumb is rotating out away from their body, and a lateral rotational movement, we call that a lateral rotation, or an external rotation, rotating out externally away from the body. So the way that we can identify this image right away by looking at the AP next to the externally rotated oblique, we see a difference right here between the radius and the ulna, and that's a key indicator of the rotation of the patient's arm. So we can go straight to the radial tuberosity in the AP and note that it's superimposed with the ulna. That is part of the criteria of a true AP elbow x-ray. But when we look at the externally rotated oblique elbow x-ray, we're going to look for a distance, that's separation between the radial tuberosity and the ulna. So we really should have no superimposition between the radius and ulna, only here at the radio-ulnar joint where they articulate. Now another thing that we will be assessing in our laterally or externally oblique elbow x-ray is that when we rotate the arm laterally, if we look at the picture of the lady in position here, we can see that she's rotated her arm externally, laterally, away from her body. Her thumb is pointing down towards the table, and in doing so, she's taken the lateral side of her arm and put it on the IR. The medial side of her arm is rotating up away from the IR. So what we're looking here on this image is that we're going to see the lateral epicondyle, lateral condyle in profile. We'll also see the capitulum sitting above, right above the radius, in profile. So lateral condyle and capitulum in profile in the laterally rotated oblique elbow image. And our clear indicator here is that distance or separation between the radius and the ulna here with no superimposition whatsoever. In this position, we describe the interepicondylar line as being placed at a 45-degree angle to the IR. And this next image here is the internally oblique elbow. So internally obliqued or medially obliqued elbow position. So we can see a big difference between the AP, the external oblique, and the medial or internal oblique. There's a big difference here because we know that the radio-ulnar joint allows for a pivot type motion. This means that when we take our arm, our hand, from a supinated position and pronate our hand, there's a pivot motion that happens at our radius and ulna, and you can actually feel it. If you palpate your forearm and rotate your hand back and forth, you will actually feel that pivot motion happening at the radius and the ulna, and this is why we have the radius and the ulna. They're crossing over one another. They're superimposing one another. So we can follow this bone, the cortical margin of the ulna here, follow it up to where the coronoid process of the ulna sits. This is the ulnar notch here, wrapping around the trochlea, and we can see the part of the olecranon process here posteriorly. So when you see the radius and the ulna superimposing or crisscrossing in this manner, that's a clear indication that the patient's arm or their hand was in pronation. Just like we see in this picture here, his arm is extended parallel with the IR, but instead of externally rotating the arm, he's internally rotating the arm. Thumb is going in toward the midline of the body. We're rotating the arm to make the interepicondylar line 45 degrees oblique from the IR. And this is the resultant image here. So what we're looking at here is that we've taken, if you look at his arm, you can follow it from his axilla region here, his armpit, down the arm. You can see it's the medial side of the arm that's making contact with the IR now, and the lateral side of his elbow is up away from the IR. So that tells us that the structures of interest in this image will be the more medial structures. So coming up here, we'll see the medial condyle and epicondyle here, and then the trochlea right here. So remember, the ulna wraps around the trochlea. That gives us that hinge movement of our elbow joint. So we can see the wrench-shaped ulna wrapping around the trochlea here. So the trochlea is on the medial side, the medial epicondyle, right? So those structures are what we will describe as in profile for the internally oblique elbow. We'll also be looking for the coronoid process here, that little pointy shape. We'll look for that to be in profile, the coronoid process in profile. We'll see the olecranon partially seated in it's seated in the fossa there, but it doesn't look like clearly, centered in the fossa as it does in the true AP position. All right, I hope this was helpful. Thank you for watching.